What's going on, everyone? Welcome to the Healthcare Hustle Podcast. Today, we are joined by Dr. Liz Holder, Assistant Director of Patient Experience at SSM Health in St. Louis, Missouri. Liz, welcome to the show.
Thank you for having me, Winston. I'm happy to be here.
Absolutely. And it is our pleasure to have you. I just got to start off every conversation with the same question. Tell us about your journey, your superhero origin story. Where does your journey begin?
Yes, I am a native of Philadelphia.
Yes.
Born and raised in North Philadelphia, Knife and Diamond for those folks that are listening.
Okay.
Proud product of Knife and Diamond. And again, in terms of my journey, like educationally, I attended all universities, colleges in the Philly market. So went to
Mm,
Arcadia University
mm,
for undergrad and studied psychology. And then from there, went to LaSalle University and got my master's. It's a clinical counseling psychology master's degree, but it's a focus in industrial organizational psychology. And I
mm.
had a minor in human resource management. And I ventured on some years later to get my doctorate at St. Joseph's University in their educational leadership program. And that's where my educational journey is. But in terms of my professional background, I started my healthcare journey at the Children's Hospital of Philadelphia.
Excellent.
And so right out of undergrad, was hired in a role there as a clinical research specialist at the Cystic Fibrosis Center. And that was really about just kind of managing data for those patients. It really gave me a great glimpse into what their experiences, what their, patient journey potentially looks like. Because again, my goal, I guess, from a career aspiration perspective, was also to always to become a doctor, not
Mm,
necessarily with an EDD,
okay.
but probably be more of a medical doctor. And
Hmm.
so, still was trying to journey and kind of figure that out, what direction that I want to go into. And my, passions and aspirations just kind of changed.
Hmm.
Knew I wanted to stay in healthcare, but my track, I wanted it to be more on like the business side.
Okay.
And so went and I pursued my master's while at CHOP and, got my master's degree within 2 years.
Mm,
And I was promoted because I had this interest. I'm like, well, maybe I want to do like the people side of healthcare and
mm.
like how to manage the people. And so I was given this amazing opportunity to work as like an administrative assistant in an HR department.
Wow.
And from there, still was thirsting for more.
Yeah.
I was young with this master's degree. I was, I'm like, oh, well, I went to this master's program. I got this
Hmm.
degree now. I know how to lead people. Well, reality kind of set in because I transitioned out of healthcare
Okay.
and I have I would say like a non-traditional kind of like track into healthcare. So I got hired as an executive team leader with
Hmm.
Target.
Mm,
And I have this, huge shout out to Target. I think they have an amazing leadership program.
mm.
And here I am with this master's degree and just thinking that, having the book knowledge just really equipped me to be a leader. But I have to say that those, my employees and my staff members that I work with, they taught me how to be a leader. That was my
Wow.
training ground on what does it mean to be a leader? What does it mean to work alongside with people? What does it mean to
Mm,
be a compassionate person, understand the perspectives of the people that you're working with, really demonstrating that empathy and compassion and just caring for the person.
right.
Because one thing that I've learned is that's key to being a leader. People need to know that you care.
Hmm.
And so I did that. Retail work is hard work.
Hmm.
And so I moved, in different executive leadership roles from different assignments. And I was in a high risk store. And at that time, I was like, okay, it's 4 years I've been in this role. And I think it's now time for me to transition back into healthcare because
Mm,
I didn't feel like I was where I needed to be. I felt
mm.
like I'd learned how to become a leader, at least initially.
Right.
There was more to learn, but still was thirsting and had this insatiable desire to get back into healthcare. And so I transitioned back into healthcare by taking a retail manager role with Aramark, Healthcare
Okay.
Hospitality Division. So that was
Absolutely.
my segue back into healthcare. So
Mm.
had that retail knowledge, but the retail knowledge that I had from Target was very different from what retail looks like in the healthcare space.
Hmm.
So, my mom used to always say to me, never despise small beginnings. So I had these big
Okay.
degrees.
Wow.
I actually had taken a step back financially and pay to transition back into healthcare. And was doing this job. And I'm gonna tell you, I went in and I worked my tail off. I connected with all the people that I needed to connect with. And there was a woman she's my sorority sister, but I also see her as being a mentor.
Hmm.
She was actually in her doctoral program, and she's like, Liz, you need to explore, um, you know, your doctoral, I think you need to go into the doctoral program. And I said, you know what? I've been contemplating it, but I just need to get some more information. So I went to the open house.
Mm.
Meanwhile, I'm still working at Aramark and still trying to figure it out, like what direction I want to go in. And I was making all of these great connections with like senior leaders. Now, in this retail role, I was also a catering manager. So I was going in and
Wow.
setting up for like executives and their meetings, but I was making those connections and kind of talking to them, having small talk about different things,
Hmm.
hey, I want to do more, just making those small connections. And so went to the open house for this program at St. Joe's because she too had graduated from my mentor had graduated from the program. And it was funny because I helped her with editing her dissertation.
Mm.
So that was with my master's degree level APA knowledge.
Okay.
So I was helping her with her dissertation. And again, I'm just kind of processing it and just seeing, what she did and just the process that she took to like go through her dissertation. And actually, I guess I helped her pretty well with her edits because she was able to move forward and defend, right?
Oh,
So
wow.
I'm like, listen, if I can do somebody else,
Absolutely.
can do this for myself. So I'm still working, all this stuff is happening and go to the program. I go to the open house at St. Joe's and I'm like, you know what? I'm going to do this. I can do this. I helped my mentor with her dissertation. I can do it. So went into the program and didn't really know what I wanted to study, nor would be something in healthcare, but didn't know specifically what. And so
Okay.
got into the program and it was amazing how and I say this because I really strongly in my faith and in God, and I felt like He ordered my steps like along the way. That even in those connections, and
Mm.
not really thinking so small of my catering gig, right? I
Right.
thought, because I was saying, you know what, these are people that I can potentially tap into if I need to ask them questions about like
Hmm.
how do I move into healthcare administration? How do I move into leadership? And so got into the program and just started really basic with like, the things that I wanted to talk about. What did I want to focus on? And so I was in the higher ed track and in the program because there were two tracks. It was either basic K to 12 or higher ed. So I went into the higher ed
Okay.
track.
Hmm.
And as I journeyed in the program, and the more I kind of got into my role as a retail manager, I'm like, you know what? I want to do something else. So I reached out to my DM. And because I really took my job really serious as a retail manager, that helped me to stand out as an
Okay.
employee,
Okay.
Aramark. So they said, Liz, listen, we have this opportunity. It's called patient experience manager
Wow.
with the health system. And I would be on the Aramark side. So really looking at patient experience through the lens of food and EVS.
Okay.
And they
Wow.
said, we want you to help us with this. And I'm
Hmm.
like, okay, well, is there a job description? Nope. We're going to put it together along the way. So just imagine, just being promoted. I'm in this new program. And we were in the state at that time where we needed to really improve our processes so we could have better outcomes with patient experience, right? So
That's
that our
huge.
patients could have a better experience with their food, so that they could perceive their environment to be clean and safe for them to receive care. And so I started to work in this more informal leadership role with
Hmm.
our leaders. And the long story short of this is that we were able to retain our contract. We were able to renew and extend our contract with this healthcare system. And more importantly, the patients were responding more positively to the survey. So the scores
Okay.
were improving. So
Yes.
it was like, okay, I can do this patient experience thing, right?
Got you.
And I really started to love it. So as I began to really get into my role, those connections that I made as a retail manager, I started sitting in front of other executives, like having conversations, because this was putting me in the room with
Hmm.
the CNO for the system patient experience officer.
Mm.
Really, to kind of really talk a lot more about how our service is connected into the clinical space, like
Right.
how important it was to patients. And so as I journeyed along in that space, I started to think a lot about my dissertation work and how I wanted it to be, I felt like useful for the healthcare industry.
Okay.
And what I saw was there weren't a lot of women that looked like me in leadership
Hmm.
jobs
Absolutely.
from a nursing perspective. And so it
Hmm.
made me start to get curious and to think and to question. And so me being who I am, and I want to say with my Philly mentality, being brave and being fearless.
Yes.
I went in and I was talking to my managers on my Airmark team, and I was like, you know what, guys? I think I want to understand what are the experiences of Black nurses here
Oh, wow.
for our patients, knowing that Philly is a very diverse
Yes.
um, healthcare patient population. And this organization kind of sat on the skirts of Philadelphia, but still serving a very diverse population.
Hmm.
What does it mean? Like, what are those outcomes? What are those experiences for those patients if we don't have a diverse nursing workforce? If we don't have people of color making decisions, making determinations at the table about how patients are being taken care of, understanding their perspectives. And so they thought it was a great idea. So they helped me to make that connection with that system CNO. Those people that I was preparing their food. And I talk about this because I think it's really important for people. Again, don't despise where you are. Work your tail off where you are. Embrace every part of your journey because it all matters. It's all going to build up to your next step. And one thing I think is so important, we are always being interviewed.
Mm. Yes.
That's something that I always
Absolutely.
tell my team. And every interaction you're having, it's an interview.
Hmm.
Folks are watching you. They're watching what you say, they're watching how you show up, how you're dressed, how you present yourself, the things that matter to you. Do they align with the organization? Is this someone we want to put in front of future customers and clients and things of that nature? They put me in front of this system CNO, and I went to her and I said, I'm curious.
Mm.
And they were on a journey themselves, really confronting DE&I.
Okay.
And at that time, I was fortunate enough in my system role to be a DE&I facilitator. They had put me through this
Okay.
immersion education with them that I would say was the most dynamic immersion experience that I'd ever had with diversity, equity, and inclusion. And so I was becoming a part of this health system. It wasn't like of course, I worked for Airmark, but
Oh, interesting.
I
But you
was
were got you.
I
Hmm.
was starting to get integrated because I was building my reputation, my relationships, my
Yes.
rapport.
Hmm.
The things that I talked about and that mattered to me, they were like, "Oh, she aligns with us," right?
Okay.
So that CNO was like, "Liz, I support your research, no problem."
Wow.
So I started my dissertation work, and completed my program. I say a little early because usually it takes folks 4 years. In my fourth year, I was doing my research, and I defended before my complete 4 years was up.
Oh,
And
wow.
so, because I guess technically my fourth year would have been like September of 2017, and I finished in March of 2017, and
Okay.
and was able
Gotcha.
to graduate in May of
Ah,
17. So, I was fortunate enough to do my research there. I went back and shared my findings to that CNO, to the patient experience. Shout out to the patient experience director who helped me. I mean, with my tools, my instruments, my participants were fantastic, and I was able to understand what their experiences were, right? What experiences hindered and barred them, but more importantly, talk about why it was important to have diverse voices at the table when
Hmm.
talking about creating policy when it comes to healthcare,
Right.
right? We want to make sure that healthcare is open to all patients. People feel welcomed. People feel that they're going to be safe and their needs are going to be taken care of, regardless of how they present, regardless of how they self identify.
Hmm.
So, from there, I was like, okay, I won the outstanding dissertation award. Thank God for my dissertation at the
Okay.
university. Um, and me and one of my colleagues, we graduated essentially top of our class. So it was a really exciting time. So I graduated while I was at Aramark, but I'm still saying it's more I need to do. It's more I want to do. And I'm grateful, eternally grateful for my entryway into healthcare administration in a health system, in a large health system. And that my manager just gave me that opportunity. And it's just been the most rewarding opportunity serving as the system director of patient experience. We've been able to do some different things here at the organization and really appreciative to have open-minded leaders
Hmm.
that understand that we have to do more
Right.
because the people that we're serving, they do have unique needs, right? They
Hmm.
all are not coming with the same needs, and it's important to hear every voice so that we can create care that is accommodating to everyone's needs. And so
Absolutely.
I have to say that I'm really blessed. And it's funny when I talk to different healthcare professionals, they're like, Liz, you're doing what? What are you all looking at? But and I'm like, yeah, like my leaders are like, they're so awesome, like they're so dope. Like we're doing this and we're doing that. And really I'm having this has been a very enriching experience for me. But I share all of that for your listeners that are just like, hey, I want to become a CEO. Like there's steps, right?
Absolutely.
There's
Yes.
levels to this, right?
Yes.
So and there's always something to learn in every experience.
Hmm.
And even though I learned how to lead as I thought I did at Target, there was so much more to leadership.
Hmm.
Those relationships, that networking, I could have thought like I got a master's degree and I'm out here putting out pizza in a retail area, right?
Yeah.
I'm in a master's degree and I'm going down here putting food on a food tray for a patient and wondering about, but all of that was important for my
Absolutely.
journey.
Absolutely.
It helped me it was building blocks for me. So just want to encourage folks to don't trip on where you are. Just continue to work hard, continue to build those relationships and take advantage
Hmm.
of every space that you're in. Enjoy those times that you're in.
Absolutely. Wow. You definitely never despise small beginnings is a very great I think message for everybody. And I feel like, number one, I just want to say thank you for doing an amazing job. That
You're
was a
welcome.
dissertation right there. Like in
Sorry.
terms of just no, it was like, no,
I'm
no,
like,
no, it's good. It's good. That's like, I mean, because you really told and painted a very beautiful picture. And honestly, there's a lot of context. I have a lot of questions. But
sure.
this is some context I'm sure that our listeners will want, but I would just want to highlight a few things because I was not aware that, you started at CHOP and then transitioned out of healthcare, right? And,
Yes.
I say that for our listeners. I'm also grew up in Philly, Philly kid, Germantown to
Hey.
be exact, but CHOP is like the dream healthcare job for
It is.
everybody. When you grow up
It
in Philly,
is.
like, if you want to work in healthcare, CHOP is where you want to be. That's the brand
Yep.
you want to have on your resume. And so I just want to shout out to you I think it would have been hard for people to make a decision
Yep.
to leave that environment, leave what that ladder may have appeared to be in that time. Particularly, you're so young, you're successful, you got that level of experience and exposure and credibility. But it just goes to show your fortitude, right? Your focus in terms of like, what you were really looking for. And that's something that I took out of it as well. Don't be afraid to challenge yourself if you feel like you actually are looking for more, right? And sometimes I
Yeah.
feel like we got to do that because we get in positions where we may feel comfortable or be in a certain organization. But if we know I need something for my development, whatever that may look like taking a step back and, doing, something that you don't think is aligned. So I just want to give you kudos for being able to really tell that story in a very effective way. I want to I want to transition because you definitely started to talk about patient experience, and I want to
Mhm.
talk about this because this is, your subject matter, expertise, and I think it's important because ever since COVID, we've been in this space of more data, disaggregation. Everybody wants the data. Give me the data. Um, and I feel like there's some great examples of people leveraging patient experience. But then I feel like, some health systems across the country still have a ways to go. And so the first thing that I would want to ask you about actually, for our listeners, so Diamond Street is a historic street in North Philadelphia. That is a
Yes, it
very all up and down Diamond Street. Beautiful, some beautiful homes. I used to love driving down Diamond Street with my parents. We used to be going to the Acme over on Fox Street, 22nd Fox. So
yes.
not on Ninth and Diamond, a little bit further up, some
Go
blocks
further
up
down.
in the 20s. But
Right.
yes. So, growing up in Philly, right? What in it, because not everybody sees the things that, maybe someone who wants to be a doctor sees in their neighborhood, in their community. So, were there distinct things that shaped your lens that, hey, when I get into a position where I'm going into healthcare, this is going to be my focus? Was Philly a part of that, or was it, your family experience? What was that kind of gave you this mission, this charge for the work that you're doing now?
Yeah, I think it was a combination of several things. First and foremost, my family.
Mm,
Um, I was raised a single family household. My dad was around, but of course, I was primarily in the home with my mom. And my mom was such a hard worker. My mother didn't have, or still does not have, a college education.
wow.
And so it was always impressed in me that you are going to go to college. You're
Mm,
going to do, more than I've done. And one thing that I feel like my mother did, because she did not have the exposure to, being able to kind of tap into different things, if she saw an opportunity where I could be embedded in a particular experience to gain more knowledge, to gain more experience, she always put me in position
mm,
to be able to dream. My mom always said, never
wow.
stop dreaming, right?
Wow.
Whatever it is you want to do, you can do it. Whatever it is you want to be, you can be that. And
Hmm.
so that was always impressed upon me. My father always encouraged me. My grandmother always encouraged me. So I always had like those people around me that was like, and my middle name is Leah. So everyone's like, Leah, you can do it. And I felt like that positive um, motivation and encouragement from my family, first and foremost, made me feel like, hey, I can do a little bit more than what I'm currently seeing. Because being raised in the
Wow.
hood,
Yeah.
I'm gonna tell you to be honest, growing up, I didn't know I was poor.
Mm,
I
mm,
didn't know I was really poor until you really start to get out around other experiences and see different things. My grandmother was a domestic worker. So she would clean
okay.
homes of rich people. And so
Mm,
that's why I was like, oh, we don't have that. That kind of helped me to see that our living is a little different, but we had a
mhm.
good home. We had a solid home. I always had things. So I didn't
Absolutely.
know I was poor. You know what I'm saying? Until you start to get out there. So I would say my mother always just pushed me and put me in environments around people. She felt like someone could be a mentor for me. She's like, you need to be around this person. I want my daughter to be in this experience. She would pay for camps
Wow.
that were, centered around science and different
Mm,
educational opportunities. So there were different things that she would put me into. So I would say it was a mixture of that. Of course, foundationally to all of it was my faith, right? So
got you.
I can do all things through Christ. It's like one of my key scriptures. So I feel like anything that comes in front of me, even to today, whether it's hard, whether it's easy, it's all gonna work together for my good and I'm gonna overcome it. And
Mm,
so that's my perspective. And so that was my foundation. And then as far as like, other things, there were people in our churches who were in college. And
okay.
so they were people that would talk to me about careers. They could talk to me about education. They would talk to me about, like doing different things. And like I was saying, one of my mentors, I went to church with her, and she was the one that kind of told me about the doctoral program. And I had aspirations to become a doctor, just didn't
Hmm.
know I was going to take it in that direction. Right.
Right.
And so, I feel like foundationally, I was put in, I was blessed. I was
Mm,
fortunate. I could have been a statistic. Honestly, probably on paper, growing up in my area,
Yeah.
it
No,
was
oh,
probably,
absolutely. Absolutely.
it was probably said, hey, she's never going to come out of this environment, this drug infested,
Absolutely.
violence infested environment. And so, I look back at those experiences and I'm so grateful because I don't think that I would have the grit. I don't think I would have the determination and the drive and the desire to want to do more if I didn't
Mhm.
have those experiences because I know what lack looks like.
Mhm.
And I know what people around us like we need. And so
Right.
when you think about healthcare, and I think about the area that I was raised in,
Mhm.
you know, I look at a lot of people, their grandparents and their parents, they were really ill,
Absolutely.
and you start to think about, healthcare literacy and, you
Yes.
know, were doctors taking out time to really get to know them? Were they assessing their social determinants of health to make sure that they have the financial ability to take care of themselves, to make sure that they have the food, you understand what proper eating and exercise and what all that means? Like, do we understand that? Growing up, a lot of people around me, had high blood pressure, it was obesity. So all of those things growing up, that's why I wanted to be a doctor because I was like, hey, I want to make a change on this front, right? I want
Mhm.
to talk about like how can we make things better? And I'm really grateful that even from the perspective of patient experience, I have an opportunity to make changes. I have an
Right.
opportunity to influence change
Mm.
and and really be that voice based on hearing the voices from the survey and the data that we get to say, hey, this is what our patients are saying is most important to them. We're not communicating well to them, right?
Yep.
And,
Mm.
and when we don't communicate well, that in turn turns into, them not adapting whatever the medical regimen it is for
Mhm.
outside of, not eating well, not maybe following up to their appointments because they don't understand the urgency behind what their current clinical status really means. So, I look at all those experiences and I think that kind of really drove me and kind of made
Mm.
me feel like, hey, healthcare is where I needed to be, so parent put me in the right position, really trying to
Absolutely.
feed that potential, feeding my desire to want to do more, and then just having those positive images around me, even though they weren't probably in my immediate neighborhood.
Mhm.
There were people in different facets of my life, in church, in school. I had a unique opportunity to kind of place outside of the neighborhood, middle school. That got me out of the neighborhood.
Okay. Got you. Absolutely.
So
That's a big deal not going to his own
that's a
school in
huge,
Philly. It's a
it's
huge
a
deal.
huge, in Philly, it's
Yes.
a huge deal, right?
Yes.
So I was at Joseph C. Ferguson, that was right around the
Okay.
corner from me. And I had a teacher I'll never forget. God bless Miss Virginia Thomas. I never forget her. She was my third grade teacher. And she went to my mother and she said, I think that she needs to go to Russell H. Conwell. And Conwell is a magnet
Mm.
school
Okay.
outside of the neighborhood. And growing up in our environment, we're around predominantly Black and Hispanic
Absolutely.
communities. But the other thing I love about my mother is my mother wanted me to interface with everybody because she
Mm.
always would say to me, you know what? You're not going to be around everybody that look like you. You need to
Absolutely.
understand how to interact. You need to know the social behaviors. And again, this was a mom who had a wonderful city job,
Mm.
didn't have a college education, but she knew how to navigate because of her own personal work experience. But she wanted me to have those experiences. And like I said, I placed out of the neighborhood middle school. And that kind of put me on a different track from everybody else in the neighborhood. And it didn't feel
Yes.
cool at that time, but I'm so grateful to God. And because I was an outsider, it was like, oh,
Absolutely.
how they, oh, she's a nerd.
Oh
And
yeah.
so
Yeah.
it did
Yes.
not feel good at that time, but really that segue into that school, put me again in a high school that was outside of the neighborhood, that was more on a college trajectory,
Hmm.
and then put me at Arcadia, then to LaSalle, and then to St. Joe's,
Yes.
and the rest is history. So, again, it was really kind of just getting me out the neighborhood and giving me a chance to see some other things. So, if that answers your question, I
No,
hope I
it
did.
no, it really did. I appreciate it as well. And I think a lot of people can relate. I myself had to go to a magnet school for high school. I definitely would not be where I'm at right now
Right.
if it wasn't for that. And I had to go to school. I got to school, go to school downtown as well. So
Oh,
it was a
nice. That's
totally
cool.
it was Science Leadership Academy of
Oh, science
Philadelphia.
leadership
Yeah,
credit. Yes.
SLA.
Okay.
So yeah, 22nd and Arch when I was, it's moved now, but that's where I used to
Yeah.
be. So catch the Broad Street
Right.
line every morning, and just even doing that, to your point of interacting with so many different diverse individuals, is so important just for exposure,
So
development,
important.
and where we end up in these spaces. You did touch on something that I love. And I think it's, I'm gonna ask you a question. Hopefully don't put you too much on the spot with this one, because I've actually
Okay.
been seeing this in my own position in some of my work. But um so again, place like Ninth and Diamond, I don't think people really can understand the actual health disparities and the social disparities and inequities that exist in these places without really being in these kind of environments. And so we both have the pleasure to serve communities in St. Louis now.
Yes.
And unfortunately, there are parts of St. Louis that give North Philly a run for their money.
Yeah. No, for sure.
And
Yep.
it is not something that at times the community has felt, hey, these big organizations, y'all could do a whole lot more. So I definitely want just to maybe address what you all are doing just in that conversation, in that regard. How are
Yeah.
y'all connecting with the community and just boasting your efforts? Because I know everyone is doing things right, but it would be great to
Yeah.
highlight that. But and you can answer each question how you want to. And then the second one, though, is specifically when it comes to patient experience, because you mentioned having great leaders where you got to buy in and they're really willing to listen and say, okay, this can enhance our outcomes. We see the power of it. But
Yeah.
something like communication, I feel like across the board, you see that no matter the department, service line,
You can
nursing
get
team,
that together.
physicians,
Oh my
the
goodness.
communication is always down. And
Ugh.
also, what are your thoughts about the disparities, particularly the racial disparities we see in communication, where at times a white patient or a white family may say, hey, we feel 80% positive, about how the nurses and the physicians speak, but you may see black or, Hispanic families, it's 50, 60%. What are some of your thoughts just around that, and what has been, your experience in addressing some of those differences?
Yeah, so I guess I'll start with the leadership piece.
Okay.
Leadership buy-in, I think, is foundational. And so going back to telling you that, like my senior leaders, they're fantastic. My boss, my direct boss that I talk to more on a day-to-day basis,
Hmm.
she understands it. She gets it. My system CNO, she gets it. And so when you have people who understand that we need to step up how we are listening to patients, that makes it easier than when you're saying like, hey, we need to look at certain initiatives, we need to dig in, and I'll go in a little bit more further about what I'm talking about. But when you have those type of leaders that get it,
Hmm.
it makes your job so much easier. In fact, um, I was a little intimidated even by being given permission. I'm gonna tell you to be
Mm.
honest,
Okay.
to be like, Liz, do your thing, move forward.
Hmm.
And I'm like, wow, these people get it with me. Like they see what I see, right? And so that's a blessing.
Mm.
That is a blessing. So I would say, I didn't have to do any type of like trying to convince. What happened is, and I'll tell you about my experience right now. We at CMS had done a research a mode experiment, and they had put out some research where
Okay.
they had mixed up the mode. Currently, the current mode to collect feedback from patients is paper. That's the primary mode. But in their study, they mixed up the mode, the methodology to collect patient feedback, and they included electronic version, email, to
Okay.
in addition to paper. What they saw was those groups that historically you could not they were not hearing their voices as much as other groups. They were hearing them more because they had mixed up the mode and
Mm.
methodology in which they were collecting their perspective on a survey. And so what they saw was, I think it was about a 13%, if I'm quoting this correct, about 13% increase with those groups. And those groups that were traditionally underrepresented were Black African American patients,
Mm.
non-English speaking patients. And I believe it was the patient group between 25 and 35.
Okay. Wow.
Um, they traditionally were not probably hearing from them as much as other groups. So as an organization, we had just transitioned over to a new patient experience vendor. We had some data. And, my team and I got with my senior leaders, and we were like, we should look at our data and see what our data is telling us. And our data was telling us exactly what CMS saw. So our
Okay.
patients of color, I'll say that, our
Right.
patients of color, we were not hearing from them. And we were seeing that, we are seeing that, I'll say, because I don't think we've been able to really go deep into the work yet, but we started, we're on a journey.
Hmm. Hmm.
So we see that when we look at survey return responses, we're not hearing as much as we want to hear from our patients of color. So we
Hmm.
started with the color component. We know, diversity is on many levels, but we started
Absolutely.
there with the race component. And so I had started working with one of our vendor partners, and it's funny, it was like at the top of 2023. I was introduced to them, and they actually manage our providers in our ED spaces in one of our markets. And so started working with them, but I was trying to figure out like how we could work collaboratively with each other initially. And they were talking about their survey. We were talking about our survey. And then it kind of hit me. It was like, you can work with them because they manage in the ED. And what we know traditionally is, looking at our surveys, if a patient is admitted via our ED, what we've seen is that sometimes the experience scores going into inpatient are lower. There's a lower. So if they have a bad experience in the ED, it seems like that whole perception, because it's really about perception, what they see, what they experience, what they're feeling, right? That transitions over into the inpatient space. So we're like, if we can work with this group to influence experiences in the ED, then maybe we can work to
Have that.
increase
Ah,
our
gotcha.
inpatient force. Well, we
Interesting.
got to
Okay.
work on both the inpatient and ED side of our,
Right.
our, our healthcare organization. So we started off with a pocket and here in the St. Louis market. I'll say the St. Louis market. We started off with, because that's where that physician group is. And one of the things that the Joint Commission, they put out this huge write-up, 22, 23, around like how to improve patient experience. One of the methodologies or approach to doing that, and making sure that you're hearing from all of the communities that you serve. One of the strategies that they recommended was unconscious bias education. And so I put together this strategic approach that talked about, engaging our care providers with education around, and not just education, but more of an experience of reflection around unconscious bias. Like just being aware that we all have bias,
Right.
right? Somebody tell you they don't have a bias, they do. That's
Yeah.
why even saying that statement. Because it's how we're made and it's how we're created in our brains. And so exploring that, and then also exploring commit to sit. What does commit to sit really mean? And it's really about presence. It's about connecting with people, how to communicate effectively, how to demonstrate that I value you as a patient, and I want to make sure that I'm taking really good care of you.
Right.
And it was so funny when you were talking about communication. Communication is really foundational to
Absolutely.
everything, right?
Everything. Yeah.
It's the vehicle to delivering quality care. It's the vehicle to delivering safe care. How
Hmm.
do I know that I'm safe?
Yes.
How do I interpret quality of care, right? It's the way you're communicating, whether it's verbally or non-verbally, as you're taking care of me. And so anyway, we put this strategic approach together, and I, you know, gave it to my senior leader, my system CNO, and she's like, Liz, who did you share this with? I was like, nobody but you. You're the first person. Of course, I showed my boss. She was ecstatic. She's like, Liz, you going in the right direction. This is great. Went to my system CNO. She's like, Liz, who else did you show this to? You're working with this company. You came together with them. You told them you want us. I said, yeah, well, we got to do this together, right? If they're in the ED, it's our folks in the inpatient setting. We got to work together. And she was really excited about it because it was something that she wanted us to explore as well. And that's why I say I'm really blessed. Our organization is blessed to have those type of leaders that really want to understand and to know. And they don't mind us exploring that. And
Right.
so this year we've had a unique opportunity to I'll say right now we've had over 1,600 of our nurses and providers in our ED and inpatient space go through our unconscious bias modules 1 and 2.
That's crazy. That's
And
amazing. That's
and
excellent, by
complete
the
it.
way.
Yeah.
Wow.
And so we're tracking our results in the ED and inpatient space. And I can say over the last 3 quarters,
Hmm.
we're looking at, so right now, because we're trying to look at it from more of a research, like statistically significant
Understood.
sample
Okay.
size with some of, and we're still seeing all the voices. So I want
Yes.
to be clear because I don't want folks to think that we're not listening to all the voices. We are. But when you look at it from a research perspective, like which groups really have the most sample size. And so the groups that
Mm.
I'm tracking to try to see, what their voices are telling us are patients who self-identify as white Caucasian, Black African American, and Asian.
Mm. Okay.
So those groups, we're seeing
Yes.
some nice trends, right? With some
Hmm.
of our communication questions when it comes to provider and nursing communication. So really excited. We're going to be coming up on a year very soon
Wow.
with that information. And I can't wait to share it. But even in the interim, our partner that we're working with, provider partner in the St. Louis market, they're having a partnership meeting in October. So really excited about the opportunity to be able to share that, as a
Absolutely.
poster board presentation and just kind of say, hey, we're doing this in partnership. And patient experience, it is a sport. It's a team sport. It's
Yes.
everybody working together in the organization.
Hmm.
It's from the person at the front door in ballet. It's the security guard. It's the nurses walking up and down the hallways or the doctors walking up and down the hallways with the cell phone. How does that make me feel if I'm looking around and I'm trying to, it's everything for a
For
patient.
sure.
So, it's a team sport. So I'm really excited that we were able to partner with them and just kind of share just our approach to hear the voices better. And so there's a lot to still come out of this survey if I were to share too, because we're not only looking at their trends, but two of the questions that we included on our survey, because we want to be more intentional about understanding experiences when it
Hmm.
comes specifically looking at right now, in our approach right now is one question we wanted to know how comfortable our patients with speaking up to their care
Absolutely.
provider. So, when a lot in healthcare, we talk about psych safety for our team members and people that work within the organization, but how comfortable do our patients feel? Do they feel like we value them? Do they feel like we're listening to them? If they tell us something that we're hearing them, we're really getting them. So we have that question on there. And then we also have a question that I think is probably more um, of a brave approach that we've taken is we want to know if patients feel like their identity is influencing the way that they're receiving care.
That's
And,
beyond brave. That is wow.
but
That's
again, it's about having those leaders to back you, right? You like,
wow.
hey, I think we should really be intentional about asking these questions. So we have a ton of data that we got to respond to. We right now, I don't know if our community knows that we're working on this intentionally in this type of way. Based on their responses and what I'm seeing from their feedback, I'm seeing some improvements. So I'm
Absolutely.
I'm believing that whoever is we're engaging with this experience around unconscious bias education, this experience that we're creating around commit to sit, based on the patient's feedback, they're feeling something, they're seeing something different. And that's how we can measure if what internally we're working on from a cultural perspective, what are our habits and behaviors and how are patients seeing it? That's how we can measure it through patient experience.
Hmm.
So we have a lot of feedback that we're getting
Mm.
that is not surprising.
Right.
People are sharing their different components of
Absolutely.
identity
Yep.
that they believe influence how they are receiving care, whether it's their sexual
Yes.
orientation, how they identify, their race,
Hmm.
what kind of insurance they show up with,
Big time.
um, if they present with intellectual disabilities,
Absolutely.
is that, if they have a history of mental health, are they
Hmm.
being treated differently? And the other thing I do want to say, and I know I'm probably talking too much right now, is that
No, no, no. You're not. Keep
the
going.
last thing I want to say, I think that has been so rich about our unconscious bias experience with our leaders. So it's two-part module. First part is around just really about awareness, right?
Hmm.
Widening your lens is what we've titled it. And that when we talk about widening your lens, we talk about how our brains play a role. And we do high level. We're not doing no neuroscience type of stuff, but we just high level talking about how we believe these bias form. You know, we're
Okay.
talking about implicit and explicit bias. But we ask our care partners in our organization and our leaders that after they've heard this information around bias, if they can share a time that, and we ask them to share anonymously, so we don't know who's sharing this information. We don't care to know who they are. We just want to hear, because to me, when people, excuse me, when folks are sharing that type of information, that's how you know folks are learning. Now, some people may not be responding because they're really reflecting, but we really ask our team to really engage in introspective thought around. Tell us about a time when you've either been directly involved with a bias or you have observed the bias. And the testimonials and the stories that folks are sharing are so powerful and enlightening. It shows us again that people are seeing these things and we have a lot of work to do. We have work to do and we're on a journey. That's why I said we are on the beginning phase of this. There's more we need to do as far as digging into the data, like our strategy and really kind of building on our unconscious bias. Next year is really talking about when you say this, the patient hears that. And that's not really just about the patient. You know, that patient experience work doesn't start between the the nurse and the doctor, or the nurse or the doctor, and the patient. It really starts with our leadership.
Absolutely.
What kind of culture as an organization are we creating,
Mm.
right? Because the way that we treat each other is the way we're going to treat our patients.
Absolutely.
And so when we get those interpersonal connections, because it's really about being on stage, right? You're always on stage when you're at work, but
Mm-hmm.
it's really about what are you role modeling as a leader, as good communication skills, as demonstrating that your team, you value your team. That same behavior, if I'm getting all of that great energy and I feel valued and I feel, respected and cared about from my leader, I'm going to do the same thing for my team. And my team's going to do the same thing for those people that they serve. And so it really kind of starts with leadership, really demonstrating that, because our staff, they are the experience. Our nurses and doctors, they are the experience. So we're not equipping them and depositing in them and inspiring them to be greater. That's where it really starts.
Mm.
So that's
Absolutely.
another piece to it too.
Wow. Um, so much. That was excellent. That is definitely for anybody who's currently a leader or an administrator working within your respective organizations. Definitely run that whole section back of
Oh,
the
thank you.
conversation. No, because there's so much that you said there. First of all, just kudos to you all. It's more than brave. It's more than bold. That question is, you talk about accountability, you talk about transparency, you talk about sending a message to the community. We acknowledge
Yes.
this. We know that
Yes.
this does happen,
Yes.
and we are giving you an opportunity to tell us about this. And then imagine creating, I think, even maybe hopefully a more safe to speak culture within the providers, because it's like, okay, you're not punishing me. No one's calling me
Oh.
and saying that this unit or this department is, prejudiced or, but we have an opportunity just to serve better. And we all are on a journey. So that's the first. I don't think I would see that happen that easily in many other spaces. That kind of question being added, and I would assume a lot of pushback. That's the first thing I really want to say. So kudos to y'all, because that is a huge step. But then also I would say just making it the connection between DEI and patient experience very simple. Right. I think a lot of times, and I know this from experience myself, it can be a bit challenging, difficult, very layered, particularly if you have resistance from people who, well, I ain't racist. I treat everybody the same.
Yeah.
It's like, when you have that resistance, it can be hard. But I think when you frame it in the context of, listen, when we say diversity, when we say bias, we're talking, that could come in the form of ageism, racism, sexism, There's
And
so many different
yeah,
things, and it's like we're all gonna be patients at one point. So
yeah.
there's something that I wrote down that I just want everyone to focus on. How does the patient interpret quality of care? That is a very powerful thought when you start thinking about patient experience, because I feel like when I go to teams and we stratify results and we start talking about it, they're straight to the clinical outcomes are good. Well, we gave them, it was in the discharge packet. So, we may not have said it, but we gave them the information. They had it, right? So they go to that process kind of mindset, quality of care. The senior leaders may be looking at clinical outcomes as well, but something as simple as attentiveness, to your
Hmm.
point,
Hmm.
seeing someone on the phone, you're walking down the hallway, you might be getting something put in, your chest, and
Exactly.
you want to
Exactly.
make sure, people are
Right.
attentive. So I think, just y'all are really showing how to be accountable. And I think, but also how to do it in a way where you have the trust of your workforce, which is the most important thing.
Well, so I don't want to make it feel like we've arrived, and I don't
No, but
feel like I haven't, I think it's a process. So even
okay.
when we started talking about unconscious bias, everyone was like, what is that going to look like?
Hmm.
And back to your point about what does it look like? We didn't our experience that we created for our team members to go through, we didn't even talk about racism.
Mm.
We didn't even talk about sexism and
All
you
the
know
other different
all the other
components. So yeah,
we didn't even go into any of that. We talked about bias, how we all have it, how we all need to be aware of it, and what it might look like. So we gave some clinical experiences, like one of the videos that we had that our D&I team kind of worked with, and that's what I love about. Shout out to our D&I leader too, because oh my gosh, he's gonna get me. He is was so instrumental. I have to give him a shout out. He was so instrumental in helping us guiding our team with the content. So I gotta give a shout out to Rod Nunn, amazing partner, amazing leader. They have so much great content. That we were able to incorporate. And so one of the illustrations was around like a clinical experience where there was a two people. And the gentleman said, they were just kind of talking about their day and the one lady, the woman on the right hand side was like, oh, I want to take care of the patient in 6:59. And so he's like, oh, she's only in for the drugs. And she said, no, I thought she was in for a herniated disc. And so, we kind of open it up and we ask our team, like, based on what we talked about, implicit, explicit
love
bias, like,
that.
what do
Yeah,
you think is playing out in this? And, so many people, because we even kind of go back to talking about frame of reference. We all have this invisible frame of reference. We all have these life experiences that people are not aware of. And
absolutely.
because we're not aware of it, it it should encourage us even the more to communicate, to be curious, to want to understand each other better. And because we don't know in that instance, I don't know what that gentleman's frame of reference was, but he clearly took something from a past experience and he was applying it to this woman that because she was probably asking for pain medication, she was in for drugs. And it's something that's so automatic like that people don't understand how that can create such a negative experience for a patient, that could potentially create an unsafe environment for a patient having those type of thoughts. And so we are just making people aware. So I'm going to tell you, initially folks were just like, well, what is that going to include? And it wasn't until some of our leaders themselves came and said and were a part of those learning experiences that they said, okay, we want you to come in front of our team. So we were initially facilitating it virtually, right? And we're even doing some 5 a.m. classes. I'm facilitating 5 a.m. classes. I'm facilitating 10:30 p.m. I'm serious about this. I'm like, listen, I'm getting in front of whosoever will at whatever time. We're going to talk to these folks about it because that's how important it is. If we demonstrate how important it is, our folks will get in front of it, right? And so We have had like 30 and 40 people join at 5 a.m. We've had 30 and 40 people join at 10:30 p.m. at night.
Wow.
So it's been eye-opening, and people see that this unconscious bias work is related to the quality and safety of care that we deliver to our patients.
That's the
It's
most
not
important connection. That's the
that's the
most
most
important connection.
it's all about how we think, because the way we think can potentially influence how we deliver care. Whether we're
Absolutely.
going to respond to a patient that they're having pain, whether we're want to properly assess a patient the right way to find out what really is clinically going on with this patient, right? And so I'm just really grateful, man. I'm surrounded by a lot of great leaders. We're like I said, we're on the beginning of this work, but I'm extremely excited and really happy that we're starting this journey.
No, this I appreciate you. And I'm going on mute because I guess one of my neighbors decided to cut their grass a little bit
Oh,
later in
no
the
problem. I
evening.
can hear
So
it.
okay, good, good. No, but I really do appreciate you sharing. And and of course, every health system is on their journey. I don't think there's any, place out there with 100%,
Right.
patient experience scores.
No.
But I think it is though important the framework that you all laid down because again, and we don't have to get into it too specifically because I have had you here for almost an hour, but there's so much to contextualize when you talk about these topics in an organization, the culture of the organization, the culture of the region, where the leaders are at, right? You have to be very methodical and strategic about how you do this because doing it in an ineffective way can be more disruptive
It can be.
to the ultimate goal that we're trying to accomplish. And so that's why I kind of want to give y'all kudos. I feel like there are some very like just direct, we're gonna do this is what we're gonna measure, but then also a very simple pathway for folks to experience things. And I think it is can be a challenge engaging the clinical workforce in general because they have a lot more to do. They got a
Yeah.
lot going
They
on,
got a lot.
and
They have a
and
lot going on.
a lot to manage and their own metrics outside, even though patient experience it should be at the core of what we do.
It
They,
is. Yeah.
they have a lot as well. So the fact that y'all can get that kind of time I think that's impressive, more than impressive, to be
Yeah, I
quite
mean,
frank.
again, I'm just appreciative and just truly humble because I'll say this. I know a lot of people don't have the opportunity, and I only know that because folks have shared it with me. But they're like,
Mhm.
Liz, do you not understand what your organization? If you see the mission, I love the mission of our organization. It's through our exceptional healthcare services, we reveal the healing presence of God. And so, how do we reveal the healing presence of God? It's through everything that we're doing. And so, again, when we talk about why are we doing this work, it's about delivering on our mission. It's about delivering safe and quality care. We can connect everything back to this is the sisters who founded our organization. This is what they set out to accomplish. This is they're smiling from heaven,
Wow.
saying like, this is how we wanted them to go after the work. This is what we wanted them to do. And so you feel like there's a greater calling and a greater purpose in what you're doing. And it's not just we're just doing DE&I. It's not
Yeah.
just that. DE&I is just like patient experience is interwoven into everything that we do. DE&I has to be interwoven the same way.
Right.
Everything has to kind of build on that because if we're not aware of our bias, what happens, right? So yeah, I'm just humbled for the opportunity and just really grateful for the people that I work around and don't take it for granted.
I absolutely love that. Liz, I want to say just thank you ultimately for everything. I think there's a lot of great call to actions and gems that you shared just throughout your conversation, your beginnings and just how you've been able to navigate your career. I think that Philly energy definitely comes out in the story, but at the same time I think that focus and that attention and even what you just said is a very powerful statement and SSM's mission and really drawing people back like, yo, like the founders, like this is literally what they were trying to do. Like it's
Yep.
this work, which is
Yep.
just that's powerful. It's just powerful to think
Within
about that.
itself.
Yeah,
Yeah.
very powerful.
Yeah.
So as we wind down, we always ask folks, if people want to connect with you, hear more from you, read
Sure,
some things that you may, I don't know if you have out there,
I
where
do.
where can they find some of those things and maybe the best platforms to connect with you on?
Yeah, so I would say LinkedIn. So I'm Elizabeth L. Holder, EDD on LinkedIn. So feel free to connect and link in with me. And that's where I really kind of share a lot of my professional things. Written some things, had an opportunity to write for an article in a magazine for our rounding experience and what we kind of brought to the organization. And just some other professional things. I am writing a book with one of my very close colleagues, my sister friend, about our journey as two Black women at the Jesuit University and our
Oh,
experience and
wow.
how we successfully were able to exhibit this Black girl madness. And we'll talk about what that madness
Oh,
is all
okay.
about. So really excited about that. It's written, we just got to get through it. So look out for that. But yeah, check me out on my LinkedIn page and you can check out some of the things that I've written and just stay connected.
That's excellent. I'm looking forward to that book because they're not going to be ready for that one. Not at all. Well, Liz, this was great. Thank you so much for joining us.
Thank you. Thanks for having me.